The primary goal of the government of Telangana is to look after the health and welfare of its citizens and children in particular. In this regard, on August 17, 2017, the Measles Rubella campaign was launched in the state for a span of 5 weeks till 25th September 2017. The MR campaign is a national level campaign being implemented in a phased manner across the country by the Government of India to immunize and protect children.
In our state, we started the campaign with the help of our Deputy Chief Minister and our Health Minister. We have taken the campaign to the doorstep of the people. We have achieved our target of 91 lakh children between 9 months to 15 years of age very successfully.
The campaign has been an enormous success across 31 districts of Telangana, with over 91 lakh children being immunized. This was achieved by reaching out to every school, madrasa, Anganwadi center, and even the most remote communities as well as locations, thus successfully reaching its target.
We started working on the MR campaign first with our own department officials like the DMHOs and the district immunization officers, getting them to do a detailed kind of line listing of the schools, etc., and having district level meetings headed by the collectors for whole coordination of the education and women and child welfare department. It is very good that all the departments worked as one, and we had huge cooperation from the political executive as well.
The credit goes to our early preparations, which has started in the month of May, where everybody has come together and involved in preparing the micro plan, which has given a thorough in-depth understanding how the program has to be taken in identifying the line listing the schools, line listing the Anganwadi centers, line listing of all targeted children.
The success of the campaign was possible due to optimal coordination and meticulous planning, which began with a state-level workshop for district immunization officers and other line departments such as education, women development and child welfare. At the district level, orientation trainings and task force meetings were held in order to take periodic stock of campaign preparedness and progress. Simultaneously, state-level communication workshops were organized for the district teams. To sensitize the community about the MR campaign, orientations were held for school principals, teachers, religious leaders, and parents at various schools. A series of continuing medical education workshops were organized at the state and district levels in order to seek and strengthen the support of private practitioners and pediatricians. Comprehensive line listing of houses were done for eligible children throughout the state. Appropriate referral mechanisms were set up in order to effectively address any AEFI cases, including trainings for the field staff. A central MR control room was set up at the state level. Cold chain storages at the state and district level were maintained to handle the optimal supply of the vaccine. An important step taken in planning and execution of big city campaigns like Hyderabad was interdepartment meetings at cluster and field levels. Across the state, including the old city in Hyderabad, there was a strong involvement of social influencers like religious and political leaders and local MLAs. Media sensitization in the state was akin with positive reporting both in print and electronic media. A 360-degree communication was planned to sensitize people about the campaign. It was achieved through various media forms like hoardings, innovative LED communication vans, auto miking, MR balloons, television spots, radio jingles, traditional media forms like drum announcement, street plays, and interpersonal communication. This was coupled with a massive social and digital media campaign on various platforms like Facebook, Twitter, YouTube, and others. All of these concerted efforts effectively enabled in addressing low coverage areas and resistant pockets.
ఎమ్మెల్యేలతోటి పబ్లిక్ అడ్రస్ చేస్తూ వీడియో బైట్స్ తీసుకోవడం జరిగింది. తర్వాత ఇక్కడికి సంబంధించినటువంటి ఎంపీతో ఇనాగ్రేట్ చేయడం జరిగింది. తర్వాత మత పెద్దలతో ఇనాగ్రేట్ చేయడం జరిగింది. వాళ్ళని ఎడ్యుకేట్ చేయడం జరిగింది. వాళ్ళతో మీటింగ్స్, కమ్యూనిటీ లెవెల్లో మీటింగ్స్ పెట్టేసి వాళ్ళని ఎడ్యుకేట్ జరిగింది. దాని ద్వారా మేము ఈ రెసిడెన్స్, కమ్యూనిటీ రెసిడెన్స్ని అధిగమించగలిగినాం.
We have conducted 6,000 sessions throughout the districts. So, where in the government schools and the private schools, each A&M has vaccinating around 200 children per session.
After the schools and the Anganwadi sessions, door-to-door survey with ASHA workers helped us reach to each and every missing child in our district.
Partner organizations such as UNICEF, World Health Organization, Lions Clubs International and Indian Academy of Pediatrics played an enormous role in making the MR campaign a success in Telangana by working in close partnership with the government.
UNICEF would like to appreciate social mobilization networks who ensured that this campaign reached every child, going house to house, school to school, health center to health center, making sure no children were left behind.
Our role was basically to build the capacity. So we started with the training at the state level, then going below to the district level and down below, training of all the medical officers, health workers and the frontline workers involved with the program.
We have used strategies like air balloons, mobile vans, displaying the religious leaders' statements and celebrity statements, and also some of our lions keenly involved in convincing the refusal schools and certain section of the communities.
The government pediatricians, all the pediatricians who are working government setup and the private setup are members of Telangana Pediatric Academy. So each and every aspect that has been covered by the pediatrician in Telangana state is a reflection of our association.
Undeterred efforts and hard work of all the departments, organizations and people in the campaign has eventually paid off.
The doctors came and met me, and whatever concerns I had as a lay person were laid to rest. They also promised me that they will take a session with the parents, because if they have any concerns, any misgivings about the same vaccine, they addressed it very nicely on that day, and the response of the parents was very good.
ఈ రుబెల్లా తట్టు అనేటువంటిది అయితే ఉందో వాళ్ళు మా పాఠశాలకు వచ్చి అందరికీ పిల్లలకు ఇవ్వడం జరిగింది. ప్రతి ఒక్క పిల్లగాని పేరుతో సహా కూడా వాళ్ళ డీటెయిల్స్ మొత్తం కూడా తీసుకొని పోయినారు. తర్వాత ఆబ్సెంట్ ఉన్నటువంటి పిల్లలది కూడా మళ్ళీ కూడా ఇచ్చారు. మొత్తం కంప్లీట్ అన్నట్టు, అంటే ఎవరు కూడా ఈ రుబెల్లా వ్యాక్సిన్ తీసుకున్నటువంటి వాళ్ళు మా పాఠశాలలో లేరు.
औरतों का ये मानना है कि ये टीकाकरण गलत है. मैं ये बोल रही थी कि नहीं, अपने बच्चों का इस रोग से भला करें.
While on the way to the school to pick my son, I saw the banner outside the school, and I went and I want my son to get the vaccination because it is very necessary for all the mothers to give their children the vaccination.
मैं MRT का टीका लिया, क्या आपने भी लिया क्या? इसे लीजिए तुरंत, इसे लेने से अपना फ्यूचर बहुत अच्छे से रहेगा.
నేను MR టీకా తీసుకున్నాను, మీరు తీసుకున్నారా? ఒకవేళ తీసుకోకపోతే చాలా ప్రమాదకరం, జల్దీ వెళ్ళి తీసుకోండి.
Successful completion of the MR campaign does not end the journey, because immediately after the campaign, the MR vaccine has to be introduced as MR's first dose in routine immunization, with parallel establishment of a strong surveillance system. We wish all the other states the very best for a successful MR campaign. Timely concerted planning and execution at the political, administrative, technical and community levels are important to sustain gains.